Hello everyone, in this video we are going to learn about pharmacotherapeutics of pancreatitis. Pancreatitis is defined as either acute or chronic inflammation of the pancreas with the involvement of either peripancreatic tissues or the remote organs. Coming to type of pancreatitis, one is acute pancreatitis and the other one is chronic pancreatitis. Acute pancreatitis is mostly mild and sometimes it is severe. It is defined as the pain in the upper abdomen and elevations of pancreatic enzymes in the blood, whereas chronic pancreatitis is characterized by permanent damage to pancreatic structure and functioning of the pancreas. Have a look at the epidemiology of pancreatitis. Complications of pancreatitis include acute fluid collection, pancreatic necrosis, pseudocyst, that means collection of pancreatic juice and tissue debris enclosed by a wall of fibrous or granulation tissue. Systemic complications include cardiovascular system, renal system, pulmonary system, CNS abnormalities, and renal and pulmonary complications may occur. Next, coming to pathophysiology of acute pancreatitis. First, acute injury may occur, resulting in the zymogen activation, ischemia, and duct obstruction, which may lead to the release of active enzymes and release of vasoactive substances and cytokines generation. This further leads to inflammation and vascular damage, which finally results in tissue damage and cell death. Here it is the structure of pancreas. Next, coming to etiology of pancreatitis, generally it is caused due to alcohol consumption, hypertriglyceridemia, idiopathic trauma, tumors, or due to any medications or autoimmune disorder, hereditary, and even due to some bacterial, viral, and parasitic infections. Next, let's have the look at signs and symptoms. The general sign is nothing but abdominal discomfort, that is excruciating pain radiating to the back, nausea, vomiting, epigastric tenderness, hypotension, and low grade fever. Next, coming to risk factors means who are at higher risk of pancreatitis is the people who consume alcohol in excess quantities, who does cigarette smoking, the people who are obese, and people who have diabetes. Next, diagnosis. Generally, pancreatitis is diagnosed either with blood test, abdominal ultrasound, computerized tomography, MRI, stool tests, ERCP. ERCP means endoscopic retrograde colonogiopancreatography. Next, coming to the main topic, that is treatment of pancreatitis. Now we'll discuss treatment of acute pancreatitis. It is mainly aimed at relieving the abdominal pain, minimizing the systemic complications, and preventing the necrosis and infection. Next, coming to non-pharmacological therapy, it mainly includes the enteral and parenteral nutrition initiation. Next, coming to pharmacological therapy, it mainly involves the administration of analgesics, which is used to reduce the severity of the abdominal pain. Have a note of drugs used and its dosages used for the treatment of acute pancreatitis. Next is chronic pancreatitis. The complications of chronic pancreatitis along with acute pancreatitis includes post-necrotic pancreatitis, vascular diseases, and some autoimmune diseases. Next is pathophysiology of chronic pancreatitis. If a person consumes excess alcohol, it may lead to changes in the pancreatic fluid which forms protein plugs. These protein plugs blocks the small ducts and it leads to the structural damage in the ducts and some acinar tissues. The formation of protein plugs will form complexes with the calcium, which is resulting in the injury and the destruction of pancreatic tissue. Signs and symptoms of chronic pancreatitis includes excessive loss of fat in fecus, that means steatorrhea. Next, azotorrhea, that means excessive loss of protein in fecus, jaundice, neuropathy, along with the complications of acute pancreatitis. Diagnosis of chronic pancreatitis is same as acute pancreatitis, but this includes the diagnosis of WBC count. Next, coming to the treatment of uncomplicated chronic pancreatitis is primarily aimed at the control of chronic abdominal pain and the correction of malabsorption. So, non pharmacological therapy mainly includes the abstinence from alcohol, which is mainly important factor in the prevention of abdominal pain. Small and frequent meals are given to the patient, that is, a diet restricted in fat. Parenteral or enteral nutrition may be given. Whereas the surgical procedures that elevate the pain include subtotal pancreatectomy or decompression of main pancreatic duct. Next, coming to pharmacological therapy of chronic pancreatitis include the pain management with non-narcotic analgesics such as acetaminophen, NSAIDs or selective COX-2 inhibitors. Have a look at the drugs that are used in the treatment of chronic pancreatitis and the dosage used. If you feel this video is useful and informative, do like, share and subscribe our channel for more pharma related notes. Thank you.